I'm going to show you how to tube a bunny today. There are basically 10 steps to tubing. You measure your tube, mark it, draw up your formula, prime your tube, insert it, test, watch, express, pinch, and extract. Make sure that when you are doing this that you're kind of in a great zone, that you feel quiet, calm, focused, that you don't have any distractions. We are using a 3.5 Utah Medical tube for this. You want to measure your tube first. You get the bun, and you're going to hold the tube from the bun's mouth down to his, okay, little wiggle wart, the bun's mouth down to his sternum. That's the end of his breastbone. And then you're going to mark your tube. I just use a Sharpie, and I've already done that part. The next thing you're going to do is make sure your formula is warm. You're going to draw up your formula, connect your tube, and the next step is to prime your tube, and that just means you're going to get all the air out of the end of the tube until you get to formula. Then I like to let my tube hang a little off the end of the table. I don't want to contaminate it or anything. Then you're going to insert your tube into your bunny. When you're doing that, if you feel any resistance whatsoever, you're going to just be patient, stop and wait. You can twist the tube a little bit if you need to. I go in on the left side. Once you're inserted all the way up to your mark and just past it, you're going to do a little test with the tube to make sure that the tube is in the esophagus and not down the trachea. If you see any bubbling coming out of the mouth or the nose, then immediately stop. And when you're expressing the formula, you're going to watch your bunny, not your tube. And then at the end, you're going to pinch and extract. So let's get started. The first thing I do with my bunnies is I stimulate the whole group first. And I do the tube-in method, so I stimulate everybody, I weigh everybody, and all my bunnies are marked, so I know which bunny, if anybody's having a problem, I can tell which is which. And I'm gonna use my chart to calculate the weight gain from the day before, and that tells me how much I'm going to feed that day. And then the next thing I do, it's a really important part, is I go and wash my hands. I don't want to stimulate my bunnies and then put my hands on the tube. You want to keep everything as clean as you possibly can. And then you're all ready to feed. You've got all your tools that you need and you're ready to feed. So let's get started. My formula is warm. I am going to, let's get a bunny. Okay, and this bunny is blue, and all right, I'm going to draw up my formula, which is already warm. Remember, prime your tube so you get the formula to the end. I like to dip my tube in the warm water for just a second. And then I'm going to make myself a little bunny burrito. And I am talking louder than I normally would when I'm working with my bunnies. All right, so here we go. I can feel, it's a matter of feel with tubing. You really have to be patient. I'm to my mark and just beyond it. And I'm ready to test. I'm looking at the bunny's nose and mouth. test. Okay. I'm loosening up the hand that's holding the bunny now. You want to have good control over your bunny when you're inserting the tube, but then now I've relaxed my hand and I'm expressing the formula. If you need to push your mark in a little more, keep watching your bunny. Okay, now pinch, slowly extract. And that bunny is nice and full. Thank you for watching.